I hope it's not.
No, 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 don't worry, we should go. Where's Nicholas? So he's there. They are.
Yes, and I'm like triple checking it.
Oh,
Even
yeah.
thing. I'm. Notorious.
You didn't have like a
US
drive,
hook,
okay, good.
And I have my laptop in my purse. So. Yeah.
So.
Practices or
Sorry, I don't have my stuff.
don't do that. Don't do that. I don't like it. I know I'm gonna get paralyzed.
Minutes, but then we want to start with the sign. So, value is in the file, and then start with that.
So it's only 10 minutes for
So, so part of my struggle with this, why like want to like almost right under the thing, but I'm really sure that trust myself that I'll be able to see it.
I wouldn't even put a trust, but yes, I think that's the way you do it. You really have to hit your marks.
Yeah. So basically, yeah, so that's a very good one. But I guess I did this time and monitoring.
She didn't know. She actually thought it was only me and didn't do it. And I said, I think it's a program. Why?
Yeah, that's true.
I said, she didn't even have a preference. It was more like
Okay.
just trying to find.
Yeah.
And she was calling it test.
Yeah, and I'm.
Well, maybe that's how we fix them after the study.
Yeah. You were trying it now. You're fine. Then take our essays right now. And she was actually mentioning, oh, those data you build into for those data to actually help.
Yeah.
Yeah.
And they also got up there, I didn't mention us and the people that were, yeah, it's.
Yeah.
It's so hard. Big under. Exactly. So I was just like.
Yeah, no, Yeah, no, very, very old. I'm working on a. So I was getting so affected and I'm looking at yesterday, right? Yeah, thank you.
After a while, we figure that out. I get running these social care for a long say. I was like, yeah, I already know.
I already like to, I like kind of like. Me and my girlfriend just would do that too, like, especially right out of grad school, we were like, cannon power, you know, that's very, so. We were the fuel.
Okay.
They worked us to both. But I mean, but we were always working on proposals and things like that. And so like we call our girlfriends just to see if they're being like, hey, can you go for a drink? Well, you know, can you meet up at 5? And if they say like, oh, I'm busy,
Yeah.
they do that, and then you like drop more, just tell each other what you would be telling each other.
So, it was like, I kept noticing it every time I was talking about driving. No, that is one. Yeah.
I'm thinking, you know, there's this other DRC
Yeah.
urban sanitation, it's not a risk,
Yeah.
the one day line. Three years.
Oh.
No, I mean, actually, really kind of the best part of all this. All these. Over. And now they've just really. And that's what I'm saying, that is it the RFI or they are reached? Well, it must be, it's hard to reach them. These are, he was 9 he set that up. Last week, so we got.
Sorry.
So I was helping no one with the appreciation party, we were supposed to have a briefing the next day. We're not getting, it's him, I can't take it on, but.
Yeah, and I know too, because our, one of the people were working on. We're working on.
But not with you.
On that, but that's what you can probably.
Right. I have another committee.
Yeah. Yeah. It must be a part of the,
Really, it's really hard because you have to kind of do nothing. But you really do it.
but at the same time, also. Want to do limit, right? So you don't need to, so I want to online, but. I can do people, and what I can do for it, to bring into. It must be timeline, right?
And now with AI. Well, I did your pen, so
Oh, maybe I don't know.
it wasn't even. Response, which is part of the and someone generated it. It was just a concept. They generated the concept. No, yeah, it's so much harder to think.
Yeah, which is, yeah, I think that's the end of my.
Yeah. And it was kind of expected.
Yeah.
And I'm pretty naive. Research protocol, right? Just to see generate production, pretty good. But then, yeah, my friend was saying, we were there, she was like, yeah, students are ready, we're gonna start grading your AI too. That's good, I really snapped back at you all. It's like, because we're not gonna bring any context, like, oh, this is English, this is the language, they, you know. So I was like, oh, that's very interesting.
Yeah.
All right, I want you to go.
Yeah. I mean, we can continue.
Yeah.
Like, have a, but I'm agreeing. And the middle of time, I don't. I mean, we can do something about it. But maybe that's right. For a lot. That, I mean, that's. Yeah.
Oh, but I meant more like. And that was like, I'm thinking, yeah, one. Or something.
This point, at what time?
Either something about. Before the time will be up or. Oh, you didn't see? We just dove in and we were about to give him to finish to give him time to focus on it. But we were talking about. Just doing that. That's a part of it. So,
that's not what you're trying to do. But I was like, no, that's too much attention. I was like, I didn't, I didn't, I didn't get one. Oh, wait. So. But actually, I left after there was, I decided to move, like. Yeah. Thea Mink. But that's not my. No. Okay, great. So you've got approximately 12 minutes for I'll let you run. Run all the way yeah. All in all, we're looking for there's a designated folder. When the stop sign goes out, that's like that. I like to time, so it's not a bad it's now. Yeah. So and like show us. Yeah. Because I'm reading the notes while I'm reading the yes, not great. Great. So it's there's a lot of
No, mine are on there. Oh, it starts with the person in charge.
The person in charge.
Yeah, but yesterday, we go on time. I mean, you don't have anything like. Made it. Glad that I made it. I know. Okay.
Slide forward, slide back.
Oh, right, you're staying.
We've been doing a lot of like.
Good, you go.
And I. Yeah, awesome.
We're trying to. I'll let you run over.
Did you add anything?
Just, if you could just slide this way so I can check the other, thanks.
So I'm just getting in there. And it will like that. I don't know one. You need to stay here. I know from previous time that we've done this with Chloe, that a lot of the questions are on things like, why is it happening and why evil and mind or whatever. Those are typically the things people are typically not about. Wow.
It's this, WFW process evaluation.
It's, no. Interrupting something. Right, this is the one I thought that you had more things like this.
You can send it to yourself and pull it up.
We're gonna log in here, it'll take a while.
Well, someone has to log in. Either I have to log in or you have to log in. Are you okay? If,
Someone else has.
can I switch you with the second person? Okay, great.
Can I pick one out? So I'm not sure because there are two of them. I'm not sure which one is the one.
That might be,
Let me see if it's,
yeah, okay.
I mean, but she can start.
Okay, great, thanks. Hello, everyone. Thanks for joining us today. Apologies for the late start here. We're troubleshooting some technical detail or difficulties, but you are in the room Sunflower for a session on monitoring and evaluation. We're going to have a slight change to the program order here to let one of our presenters troubleshoot some problems with technology. So we're going to start with Thea Mink from Emory University with a presentation called Who Participates in Participatory Design of Wash Infrastructure, a Mixed Methods Process Evaluation. It's on the desktop. This one, I can pull right below this one. Yeah. Yeah. If it does not work,
All right, good afternoon, everybody. Thank you for your patience. It's a pleasure to talk with you today. I am representing Emory as well as RISE, and today I'll be presenting on the findings of a mixed methods process evaluation of an infrastructure design process. Okay. a little bit of technical difficulty. So for some background, this process valuation is set within revitalizing informal settlements and their environments, also known as RISE, which is a water infrastructure trial that's taking place in Madagascar, Indonesia, and in Suva, Fiji. RISE is a wastewater treatment and management intervention, and its hypothesis is that improving the physical infrastructure of informal settlements can improve ecological and human health and well-being. The intervention itself is decentralized and nature-based and includes components like pressure tanks, constructed wetlands, and rainwater collection. And there's 6 intervention sites that in Indonesia and in Fiji where the intervention is being randomly allocated to. There's more information at the end of my presentation on RISE itself and infrastructure, but the focus of our process evaluation, as well as the presentation today, is specifically on the design phase of RISE. And this design phase engaged with intervention settlement residents to design the infrastructure prior to construction. So the intention of the RISE design phase was to meaningfully engage all community members, which included women, men, youth, elders, those with different disability statuses, among others, to co-design the infrastructure. And the aim of this co-design was to have the infrastructure meet their needs, meet their preferences, and ultimately create a shared value in the infrastructure. So design activities were conducted both at the settlement level through a series of community design workshops and at the household level through household visits. Activities at the community design workshop series included various mapping activities and visioning exercises, as well as structured conversations around possible infrastructure options. And then household visits were conducted with each household in each intervention settlement and talked about household and settlement level infrastructure preferences in a more private setting. So before I go too much more into our findings, I just wanted to give a brief primer on the value of process evaluations. And at a very high level, process evaluations get at how was intervention delivered compared to how it was intended to be delivered. And such questions underneath this include, who did it reach? Did it underreach or overreach certain groups? And what did participants think of it? What was participant satisfaction with intervention, such as the design process? Answers to these process questions are important, both because they can help explain intervention outcomes, and they can also help improve interventions. So with a process evaluation, with these process components and with others, you can get a better sense of what was actually delivered, and that can contextualize outcomes as well as adjust implementation if needed. So with that primer, I just wanted to touch on our research questions. For REACH, our primary research question was who participated in RISE participatory design activities, including quantitatively, what were the sociodemographic predictors of participation, and qualitatively, what were the main barriers to participation. We also asked what was participant satisfaction with engagement in RISE design activities, including what were the sociodemographic predictors of participant satisfaction. So we were interested in the characteristics of those who had more or less satisfaction. Qualitative data collection was conducted with residents in Fiji and Indonesia, as well as RISE staff. This was done after the participatory design phase, but before construction. And participants were sampled for a diversity in gender, functionality, settlement location, as well as level of participation in the activities. And then thematic analysis was conducted with the data. For our quantitative data collection, surveys were administered also with residents in Indonesia and in Fiji, again, after the participatory design phase, but before construction. And the survey asked questions on participation, satisfaction, as well as functionality. We also use sociodemographic predictors. These are the variables that we evaluated in our analysis, and these were collected from earlier RISE surveys. For quantitative analysis, our logistic regression outcomes were participation in the design workshops and in the household visits, as well as satisfaction with participants' own influence over decision-making. So to look at satisfaction, we asked participants 2 questions. What was your experience level of influence over RISE decision-making? And then what was your preferred level of influence? And the response options to both questions were none, a little, or a lot. So if those response options aligned, we classified those participants as being satisfied with their level of influence. And if those response options did not align, then those participants were classified as either wanting more or less influence. So to start with our participation results, we found that there were sociodemographic predictors of participation in the community design workshops. In Indonesia, gender, marital status, and age were significant predictors. And to highlight gender, in Indonesia, women's odds of participation were 2.6 times those of men. In Fiji, below, disability status was a predictor of participation in the design workshops. So residents living with disabilities, odds of participation were 0.1 times those not living with disabilities. Here we have our predictors of participation in the household visits, the second activity. Again, to highlight gender, women in Indonesia had even higher odds of participation compared to the design workshops, and women's odds of participation were 3.6 times those of men. For Fiji, there appeared to be no significant predictors of participation. So notably, disability status was not a predictor, which suggests that household visits had better inclusion than the design workshops. These are our qualitative barriers to participation in the design phase. So for barriers related to participatory design delivery, the main theme that emerged was that participants just had a time conflict. Participants in the survey had a time conflict. As well, some participants said that activities were too long. There's also some participant distrust with RISE, based on prior experiences with other projects that did not fully deliver on project outcomes. For barriers related to social and gender inclusion, mobility was a cited issue both in Fiji and in Indonesia. And then in Indonesia, there's a perception of RISE as being a women's program. And this is primarily thought to be because one of the primary outcomes of RISE is around child health. But this perception from men might have played into why they had lower odds of participation in the design activities. So we've covered our participation results, and now we're moving into our satisfaction results. Overall, participants liked the inclusive and participatory nature of the RISE activities. And in particular, most respondents to the qualitative data collection in Indonesia said that RISE was the first project in their experience to try and include all community members. In Fiji, there were mixed opinions on satisfaction with engagement. In a couple communities, some participants felt like they weren't consulted enough, either by the community representatives or by RISE directly. But then in remaining communities, residents felt like they were sufficiently consulted. For our quantitative satisfaction results, most groups we assessed were satisfied with their level of RISE-related decision-making. In particular, in Fiji, 70% of respondents were satisfied. However, among the 30% who were not satisfied, we did find that there were sociodemographic predictors of satisfaction, which I will go into here. In Fiji, we had 2 interesting results. So this first model is looking at the outcome of those who wanted more influence compared to those who were satisfied with their level of influence. And in Fiji, women's odds of wanting more influence were 3.3 times those of men. So women had an higher odds of wanting more of a voice, even though, as we just saw from the quantitative participation results, that they had similar odds as men of participation. The outcome of the second model is looking at those who wanted less influence compared to those who were satisfied. And here religion was a significant predictor. So here, religious minorities' odds of wanting less influence were 2.4 times those of majority Christian respondents, which is a mouthful, but in other words, in Fiji, religious minorities who are predominantly Hindu were more likely to want less of a voice. And I'm happy to talk about this more in the discussion section. And lastly, there appear to be no significant predictors of participant satisfaction in Indonesia. So we have a few takeaways from our process evaluation. With REACH, it's notable that RISE participatory design reached most assessed groups, particularly women in both locations and also particularly through household visits. It's also important to note that disability status in Fiji was a predictor of participation in the design workshops. And it's also important to acknowledge that we may have missed groups through our data collection. But overall, RISE's participatory approach had good reach. For satisfaction, participants were mostly satisfied with engagement, although as we saw from the results in Fiji, the results there were more mixed compared to those in Indonesia. As for next steps, our reach and satisfaction results can help inform the participatory design process in the control settlements eventually, particularly in Fiji around disability inclusion and engagement with women and better tailoring engagement with Hindu Indo-Fijian participants. And lastly, I just want to leave with the sentiment that with participatory design, process evaluations can help reflect on the quality of engagement and how to engage better with diverse populations. So with that, I would like to thank the participants in our study, as well as the Water for Women funded team. And I also wanted to list some resources that may be of interest. And I'll take any questions.
I could get you to just step to the side so we can load up the other presentation.
We're still doing Q&A. I'm just troubleshooting issues in the meantime, so please.
And I wanted to dig into what you had said about religion, how there was certain groups that wanted less influence.
Yes. Yes. Absolutely. It's hard to talk about that more in depth under 13 minutes. Yeah, in Fiji, religion and ethnicity are very closely related. So Itauke native Fijians are predominantly Christian, and Indian Fijians or Indo-Fijians are predominantly Hindu, but also Muslim and Christian and Sikh. And this also is going into larger historical context, but there's been some interethnic tension that's rooted in British colonialism, and that has evolved and persisted to today. So regarding our results, one of our interpretations is that religious minorities, Hindu Indo-Fijians, wanted less influence because they wanted to potentially avoid conflict in community design spaces in the settlement level. So that's one of the things that we want to layer. So there's an opportunity for RISE within the control settlements during participatory design to better tailor that process with this group, particularly including Indo-Fijian RISE staff members, and then also delivering the participatory design in more neutral locations, so in community halls versus church spaces, which may or may not have made Indo-Fijians feel more or less welcome. Great. All right.
Great, thanks. All right,
right.
thank you.
Thank you very much.
Do you mind going next? We're having ongoing technical problems. Thank you. Oh, you got it. Oh, perfect. Okay, great.
Thanks for being with us, everyone. Okay, we are back to the first person on your program. We have Tina Muvuti from ADRA, whose presentation is titled Identifying and Interrupting Fecal-Oral Pathways in Children Under 2 Years in Southeastern Madagascar.
Good afternoon. My name is Tina Muvuti. I am with the Adventist Development and Relief Agency. I'll be co-presenting with Valerie from Acquire and on the topic identifying and interrupting fecal-oral pathways in children under 2 years in Southeastern Madagascar. Our work is based on research that was carried out in the southeast of Madagascar in the provinces of Atsimatsinanana, Vatovavi, and Fitovinani. The work was carried out, it's based on research carried out by Acquire, led by Acquire with the participation of ADRA and NEET and INSICA, and funded by ProWash. Infants and young children are at an increased risk of malnutrition and stunting. And over the past few years, there's been an increased focus on the idea that it doesn't always have to do with lack of nutritious food, but then there are all these other factors that go into increasing their risk of stunting and undernutrition. So unsafe water, poor care practices, and just poor access to wash services. And in Madagascar, this is a cause for concern. 50% of children, at least about 50% of young children in Madagascar under the age of 5 are stunted. And this has something to do with the poor wash conditions. 9% of households in rural areas have no access. Only 9% have access to safe drinking water, and 54% still practice open defecation. And these numbers are even worse in the southeast of the country. 4% have access to safe drinking water and 66% still practice open defecation, at least in 2016 when these numbers were collected. Fiovana is a resilience food security activity funded by USAID and implemented by ADRA in the southeast of Madagascar with the aim of improving food and nutrition security and the resilience of people in Southeast Madagascar. So one thing was clear when the activity started, that if we wanted to move the needle in as far as stunting and undernutrition is concerned, then we had to spend some time focusing and trying to identify specific pathways that through which children are exposed to pathways, and then trying to interrupt those pathways.
So I will very briefly discuss some of the methods and results that we did for this research, and I'm presenting on behalf of my colleague Chloe Poland, who did this work with Acquire. And so there were 2 main research questions that the work aimed to answer. And the first one, like Tino said, is really what are the main ingestion pathways of fecal pathogens for children under 2 within the implementation area. And this was investigated through fieldwork at 220 households using a combination of household surveys, structured observations, spot observations, and sampling for E. coli and pathogens. This data was then fed into a QMRA model to assess the risk of infection and illness associated with different exposure pathways. And then, of course, the results were disseminated. The second question was more implementation-based, looking at what are the most feasible, effective, and contextually appropriate interventions to reduce fecal pathogen exposure for children in this specific context. Of course, we all know there's several different transmission pathways for fecal-oral pathogens, and for this study specifically, we focused on 4 of them, including drinking water, soil, hands, and food. Within these environmental compartments, like I said, we looked for E. coli and 6 different pathogens that are defined on the slide, and then within the same households, they also sampled child feces as well as animal feces in the area and searched specifically for the same pathogens. This shows the results of the pathogen analysis for both the environmental compartments and the animal and fecal samples. And there's a few main things I think that really stand out on this slide. So the gray bars show the prevalence of any pathogen that was detected in each of these sample types. And then the specific colored bars show the specific pathogens for the 6 different types. And these samples were collected at a subset of 26 households where they attempted to analyze samples for all of these compartments, but there weren't always, all of them available. So some of them are slightly less than 26. But in general, the findings were that animal feces had higher levels of pathogens than child feces, with pathogens that we would expect to find, such as Campylobacter and Shigella. And this was primarily poultry and cow feces. And then children's feces had a bit of Campylobacter, but also showed Giardia and adenovirus, which was more similar to the drinking water pathway, which was the only environmental compartment where we found Giardia and adenovirus. So there's some clear links between the child's feces and maybe their exposure coming from drinking water within their household there. And then in the child hand rinse and soil, we found the Campylobacter and Shigella that was more similar to animal feces. And looking throughout the pathogens, hand rinse and soil samples were the most contaminated compartments, but there was also a fairly high amount of contamination within drinking water. And so these results were also assessed for the different compartments using E. coli. And again, the levels of contamination were quite high among hands, drinking water, and soil in particular. And so this graph shows the level of E. coli, where red is, the most contaminated and green is no contamination at all. And you can see a lot of contamination across compartments, but in this case, the highest levels of contamination were in soil and drinking water. But it's not quite so different from the pathogen contamination. There was a lot of contamination with both pathogens and E. coli across the hands, drinking water, and soil pathways in particular. Like I mentioned earlier, these results were then fed into a QMRA model where exposure information related to likely exposures for the 4 pathways was combined with the contamination results to try to understand the dose that would be consumed by the children and where their exposure would be most likely coming from when we look at risk characterization. This shows the results from the QMRA analysis, specifically looking at the quantity of E. coli that would be ingested per day for children in different age groups from the different compartments. So looking at this, you can see the children in the 0 to 6 month age range had very low exposure comparatively to older children. And the 7 to 12 and 13 to 24 months had pretty high levels of exposure. And all 4 of the pathways that were considered, the soil, cooked food, drinking water, and hand-to-mouth contact, were important for both of these age groups. Although for the 7 to 12 months, the cooked food pathway was slightly less important because a lot of children were still being breastfed, and the direct soil pathway was slightly less important for the 13 to 24 months because direct soil ingestion was less common among that age group as children grew older. So I'm going to pass it back over to Tina, where he can talk about some of the implementation and recommendations from these results.
Before I start, because it's so little time to go through what we did with these results, which is what I'm going to speak about in the next couple of minutes. But on Friday at 8 a.m. to 10:30 a.m., there's a side panel where we're going to get deeper into this discussion about all the research that has gone on in this space over the last couple of years and what different organizations and different activities, not just this activity in Madagascar, what they are doing with that information and the progress that they've made to try and reduce the ingestion of pathogens specifically for children under 2. In our case, the results gave us so many recommendations to start with. And the first stage was getting together all the stakeholders that have something to do with WASH and health, child health in Southeast Madagascar, into a room to discuss what exactly we can do. What are the things that we need to focus on at a community level, at a household level? What are things that are expected of parents? What are things that the activity can do? Which are things that most organizations would typically do, focusing on water and repairing water infrastructure at the community level, but what can also be done at the community level and at the household level. And the recommendations were grouped by pathway, so drinking water, soil ingestion activities, hands to mouth, cooked food. And remember that the importance of all of these activities differs by age group. So the task that was before us was, how do we put our finger on what's the most important and what's the most important at the different age of a child's life? In the Fiovana activity over the past couple of years, we have been working with our SBC team from FHI 360 on 5 life stages of a child's life. And we have family scorecards, and don't look too closely at the specific activities there because you're not going to be able to read it and it's not in English. But the important thing is each scorecard represents a specific stage in a child's life. So the first scorecard that you have there is a scorecard for pregnant mothers. And then the second scorecard will cover a child's life from 0 to 5 months, and then from 6 to 11 months. And then the fourth scorecard that you have is from 12 to 23 months. The last scorecard is not on there, and you'll see it a little later. But then what we tried to do was find a way for mothers and specific households to focus on the most important action that they can practice in their home to make sure that they're safeguarding their child against pathogen ingestion, and identifying that and making sure that they find a way to keep themselves accountable. And what can the father contribute? What can the mother contribute? So you have actions, for example, on the second scorecard, where hand-to-mouth ingestion is a big thing. You have actions like the father helping out with making sure that resources like water are available in the home, so that actions like hand washing can be practiced. On the third scorecard, you see where eating practices starts to be a big exposure pathway. You start seeing actions like feeding practices coming up on the scorecard. Something that we've spent a lot of time focusing on the final scorecard is ingestion of pathogens through child mouthing behaviors. And in Southeast Madagascar, it's been important for us to be able to find a way that is appropriate for the context and easy for mothers to adopt, for that to reduce a child's contact with the ground. And mats is an easy way that we're doing it in Madagascar. And we've spent a lot of time focusing on finding that we're ensuring that what we're proposing in mats is available to those who want to practice it, is affordable and is acceptable and can easily be adopted, and that we'll be able to sustain it in the long term. Thank you so much. Any questions, I guess? Yes.
In my experience in the model context, we do see a lot of modeling, so continuous metaphoric sorting movement, particularly from like 12 to like 18-ish months. So I don't know if you try to slice your data differently and doing the age groups differently, because the 12 to 18 or 18 to 24 months is the more substantially different. And the second question was like on like the enhanced slots. It showed at least that the exposure from hand was not as much, but we did see the intervention to get kids to wash their hands as a sort of a counter effect, because once they have wet hands and then they start falling on the floor, they actually were exposed to more soil that way. That it was kind of to be encouraged to wash hands, and then they did have like for drying the hands to ensure that the kids weren't exposed to actually more soil than they were. So I don't know if you can speak to it.
You want to take the one on the data and slicing it by groups?
Well, I think that's really interesting. Like I'll start with your second question, because I think that's really interesting. Like, when we do interventions and then they have kind of an unintended consequence. So now that children's hands are wet, they were just clean and now they're actually getting dirtier because, more soil is sticking to them. For the age groups, I'm not sure how the specific age groups were selected. I don't know. Yeah, this is like, there might be more details on this in the report, so I wasn't involved with that. Well, I wasn't involved with this work. I'm presenting it on behalf of a colleague. But my understanding is that often, at least like for the specific context, a lot of the soil ingestion and hand-to-mouth contacts were a lot lower than what was seen in other settings. So it was like substantially lower. And so I think that might be why it's so low in that group, but I'm not certain if they looked at the subgroups like you recommended or not.
I'll let you take one more question while I transition the technology.
Any other question can come in. And then on the age groups, a lot of them, we were lucky that we have an ongoing nutrition program. And the idea was to layer our wash interventions with that. And so, for example, the age groups are the age groups that we've been working with for child feeding and nutrition activities. And we were in a good place to be able to work with the same age groups for the WASH study. It would be interesting to see how that changes if you're to test different age groups. That's not something that we did.
Great, thank you.
Can I take one more question?
Yeah, so I saw a few more hands in the audience. Just to be sure that we're staying on schedule here, I'll invite you to come up and ask our presenters additional questions after the session if you have them. Thanks. Up next, we have Rebecca Bloch with North Carolina State University, who's presenting on increasing blue-green algae exposure, calls to animal poison control, North America 2010 to 2022.
Hi, as she said, my name is Rebecca Bloch. I'm a postdoc student scholar at the Center for Veterinary Medicine at North Carolina State University. And I'm going to be talking about a study we undertook looking at trends in harmful blue-green algae exposures from companion animal poison control data in North America from 2010 to 2022, and how the role that these animal exposures might play as a possible novel environmental sentinel. So to begin with, just a little bit of background about blue-green algae or cyanobacteria. It's a naturally occurring photosynthetic organism that occurs mainly in freshwater, but can also occur in salt or brackish water. Large aggregations of cyanobacteria are called blooms, and their growth is favored by warm, stagnant water. Blooms are called harmful when they produce toxins that can cause illness or even death in humans and animals. Often, water discoloration accompanies the presence of harmful blue-green algae, but toxins can be present without visible signs or discoloration. So in this picture, you can see a greenish discoloration to the water. There is a harmful algal bloom, blue-green algae bloom there, and this discoloration is the result of that. So over time, reports of harmful blue-green algae have increased, and contributors include a warming environment, nutrient runoff, increased freshwater usage, and increased atmospheric carbon dioxide levels. In this picture, This is another harmful blue-green algae bloom, but as you'll note, it's causing a brown discoloration to the water as opposed to the greenish one in the previous picture. So humans can be exposed to harmful blue-green algae in a number of different ways, and those include ingestion of fish or shellfish, through accidental ingestion with activities such as swimming, and then dermal contact with contaminated water. And these exposures can lead to symptoms such as diarrhea, vomiting, nausea, rash. So like humans, animals can be exposed through drinking water or swimming. Unlike humans, animals, and most specifically for this presentation, dogs can be less discriminating, and so they can be exposed to contaminated water through licking or grooming of their fur. They can also, which is kind of gross, but they can also enjoy consuming algal mats. So this picture shows just a dog drinking from a natural water source, which is a possible route for exposure. The published literature supports the use of animals as sentinels for everything from environmental exposures to cancer outcomes. Likewise, in the literature, we find that harmful blue-green algae associated illness or death in animals has been documented to precede human illness, serving as a warning of health risk. Most commonly, illness in dogs also takes the form of vomiting and diarrhea, but you can also see things like stumbling and lethargy. Given the dangers that harmful blue-green algae can present, surveillance is really important. And while a lot of that surveillance occurs on the local or state level, there are national surveillance efforts. One of those, so those include the National Centers for Coastal Ocean Science, which does real-time satellite monitoring of the Great Lakes and coastal regions where harmful algal blooms are known to exist. So that's more on the environmental surveillance end. On the health surveillance end, the Centers for Disease Control and Prevention One Health Harmful Algal Bloom System, or OHABS, is the only comprehensive human and animal health related harmful algal bloom surveillance system in the United States. They get reports of human and animal illness from participating state and territorial personnel. And while that data is publicly available, there is a time lag to when it's made available. So while these systems are excellent, there are gaps in what the surveillance is able to look at. So that brings us to our study. The American Society for Prevention of Cruelty to Animals, or ASPCA, Animal Poison Control, is an emergency fee-based poison control hotline that serves the United States and Canada. Calls come in regarding toxicants that are coded and maintained in a proprietary database called ANTOX. So it's a unique national data source that hasn't been previously used to describe harmful algal blooms, blue-green algae exposure in animals. The objectives for this study were to determine trends for the ASPCA Animal Poison Control harmful blue-green algae call data from 2010 to 2022, with special attention paid to variations over time, season, and geographic division. To compare the harmful blue-green algae call trends to a measure of public health awareness of harmful algal blooms, and to consider the suitability of these data as a public health information source. So calls that, for this study, we analyzed calls made to the animal poison control from the US or Canada from January 1, 2010 through December 31st, 2022. Calls that were assessed as a high or medium likelihood of exposure by the animal poison control trained staff members were included, while those with low or unlikely exposure, as well as those related to blue-green algae supplements, were not included. The included harmful blue-green algae calls were then analyzed as a percentage of the total calls by year, as well as by season and geographic division. And then we also characterized public health awareness by looking at quantifying Nexus Uni Index news publications in the United States from 2010 to 2022 using the search term harmful algal bloom. So in terms of results, with over 2.7 million calls to the ASPCA Animal Poison Control Center over the course of the study period, we had 999 calls that met our inclusion criteria. Of those, just over 99% were related to dogs, the remainder to cats. And then approximately 96% of those calls came from the US, 2% from Canada, and just over 2% where call location was unknown. Quite simply, the vast majority of animals, dogs mostly, were exposed through dermal and oral or oral only routes. The map shows the United States divided into the 9 geographic divisions as defined by the US Census Bureau. The inset maps on the bottom show Hawaii and Alaska, which are considered part of the Pacific region. Also on this inset map is Canada, which is just shown in the inset to be able to focus more on the continental United States. So what you can see from this is that the darkest colors represent the largest numbers of calls from those divisions over the entire study period. The Pacific, Middle Atlantic, and New England regions have the highest numbers. This figure has a lot of information on it. What you're looking at are the numbers, which are represented by the bars here of calls, and then the percentage of calls, which is represented by the lines. So the number of calls are divided out by season and by year, and they correspond to this axis on your left side. The percentages are the total number of animal poison, like the total number of our study cases over the total number of calls for each year, and they correspond to the right-hand axis. What you'll notice in terms of trend is that these lime green bars that are the tallest, consistently the tallest, come from the July through September time periods. The other thing is that there's a general trend of increase over time with large steps in the 2014 to 2015 range, and then the 2018 to 2019. This figure is another way of looking at things. So we're looking at the numbers by division as well as by month. And so again, the New England, Middle Atlantic, and Pacific regions have the largest numbers. In terms of timing, all 3 of those have their largest peaks in August. There's a little bit of variability in terms of the divisions. And you can see that with the mountain division, it actually peaks in September, so slightly later. This last bit is the Nexus Uni Index news publications. The darker line on top in blue is the Nexus Uni news publications, which corresponds to this axis with much larger numbers. The bottom line in lime green is our study calls over the years, which corresponds to this. Similar results is that we're seeing a trend of increase over time with peaks at 2015 and 2019. So what does this all mean? Basically, there's annual percentage increases in harmful blue-green algae calls were almost exclusively due to July through September call volume, which was largely driven by the New England and Pacific divisions. Public awareness of harmful algal blooms could have contributed to increased harmful blue-green algae calls. And dog harmful blue-green algae associated illness can act as a sentinel and warning for human health risk. Dogs may accompany people to locations where harmful blue-green algae might be encountered, and their exposure routes are similar to those of humans, so that dog illness could be the first sign of harmful blue-green algae presence. So in conclusion, dog harmful blue-green algae exposure calls are a possible novel sentinel for harmful blue-green algae presence. Education and awareness are important for recognition of harmful blue-green algae exposures and reporting. And if evaluated in a timely manner, this call data could be a useful public health information source to assist in early warning of harmful blue-green algae events. So I just want to finish by acknowledging and thanking my co-authors and collaborators, and I'm happy to take questions. Yeah. So it's not that accessible in that you can just look it up, but it's as accessible as just calling them, like calling their hotline and asking to talk to somebody, and which is what I did. So, and they put me in touch with somebody. So it's pretty neat.
You said it's a fee-based system, so people have to pay for this. I mean, in terms of how it might work as a function of the system, doesn't that exclude large proportions of the population potentially?
It's entirely possible. And so there's been literature sort of in both directions. One is that you have to pay for it, so therefore it probably not everybody's going to want to partake. On the other hand, somebody from a different university was doing work around accessibility to those kind of systems in places in lower income areas, and it's less expensive than going to the vet. So if it doesn't require something that, you know, they want to check on, but they don't necessarily want to get totally into, you know, having their animal hospitalized or whatever, it can be a less expensive. But it's a totally valid point that it's not perfect. There's definitely gaps. There's definitely states. I didn't show it on the state level, but there's definitely states that don't call any, like, missing calls. So. Thank you for your time.
Great, thank you. Up next, we have Bethany Caruso from Emory University with a presentation prioritizing indicators for national and global monitoring of gender in water, sanitation, and hygiene.
Thank you. And I want to start by just acknowledging that I am one person, but there are a lot of people involved on this, even beyond those listed on the screen, which I will get into. And many of them are here in the room. So thank you to them. I'll be talking today about the process for prioritizing indicators related to national and global monitoring of gender in WASH. I can start with a little bit of background. As some of you might know, most of you probably know, the 2030 SDG agenda prioritizes achieving gender equality across all 17 goals. And that includes WASH, even though it's not really explicit. So SDG 6 does intend to have available and sustainable management of water and sanitation for all, but it is gender blind because none of the targets associated with SDG 6 actually enable gender specific reporting. You might know this because you might be familiar with 6.1 and 6.2. We report on the household level. So this work with the JMP team was to identify priority gender and WASH indicators for integration into national and global monitoring with specific attention to SDG targets 6.1 and 6.2. The intention of this presentation is really to describe the deliberate process we went into for this prioritization process, and also to share the priority indicators that were identified. Hopefully some of you had the opportunity to see the presentation on Monday from the JMP team, talking specifically about the 2023 report, this special issue on gender. There are several pages in the beginning that talk about gender and WASH specifically, and there's more information that is about the process that we undertook specifically for the first phase of this work, which is the review phase. I'm going to talk a little bit about that review phase before I get into the prioritization phase because they are related. So the first phase was a review phase. This started actually as early back as 2020, where Emory and JMP launched a collaboration to really review what was out there in terms of measurement and monitoring. What survey items, what indicators were people using as well. So we developed first a conceptual framework to guide this review process. We wanted a way to sort, think about, organize what it was that we were finding. This framework was externally reviewed. And you can see it here, and it's written up in this report. There's going to be a few QR codes, but I'll have them all at the end if you want to have access to these. So we came up with this framework. And all of the dimensions of this framework are also talked about in that JMP report that I also referenced as well. We have definitions about each of the constructs that we're presenting and why we think that they're relevant for gender equality. So one of the things that we did next was we created an inventory of tools and measures, and we sorted them by the framework dimensions. There were over 78 tools reviewed, and so you can see some of the list of them here. Can't go all the way down. And so we have a tab with all of the list of the tools that we reviewed. And then what we did is we looked into all of these tools and we sorted individual items by these dimensions of the framework. So here's just a snapshot on privacy. You can see the source, the relevant questions, how it was answered. This tool is also available for you online, though it might be a few years older by now, but I want to just point out on the bottom how it is sorted. So those of you who might be doing time and labor, issues around safety, privacy, health, these might be a good starting point if any of you are interested in this work. The next thing we did is we realized when we're doing this work, sometimes when you're searching for things, it doesn't really reflect the reality of what people are doing. People are still working, creating tools as they go. They're doing research that they haven't published. So we collaborated again to continue to collaborate to launch a series of expert group meetings in order to talk with people working in this space about ongoing research, tools that they had, any gaps that we had failed to identify through this review and this review process, and brought together people for multiple days in terms of looking at also approaches to collect new data or leverage existing and ongoing data collection efforts. This whole process, the review, the tool sorting, the consultations was written up in a final report. One of the main things that we realized going into this is that there's actually far more ways to measure gender and WASH than I think we previously had understood. So with that, there's a need to really prioritize what we want to look at. So we also felt that we as a team at Emory were really well positioned to have set the groundwork and done the review and organized the tools, but we were not in a position to do this work ourselves, and it really required a lot more collaboration. So to that end, we started a prioritization phase of this work. The Emory team joined with a group of experts that we brought together, experts in gender, measurement, WASH, and some of those people are mentioned here. What we did is we held a series of asynchronous activities as well as some synchronous activities. And the first thing that we did is we felt like we needed to identify what are the priorities of what we want to measure thematically. We leveraged what we already did. We took the framework that we already had and we worked with this framework. So we had our first asynchronous activity where everybody commented on different dimensions of this framework. So I'll give you an example. The first thing that we looked at was time and labor, is this dimension of the framework. It was defined, we have a description, and then everybody on the team was to write a comment about what they felt, what they knew about this. If they didn't have any expertise in this area, they could just use these comments to read and learn from. So you can see some of the comments here, very relevant, crucial. This was specific to water, but we did this for water, we did it for sanitation, we did it for hygiene. So lots of areas to explore. The next thing we did is we had participants in a separate activity rate each of these by these criteria. So what we have here is these, again, time and labor, water. What is the evidence of how time and labor might be important related to water? Do we have something here that's measurable? Is there potential for this to change over time? Is it comparable? Is it useful for practitioners and policymakers? We then took all these data and we presented them back to everybody on this core team. We did this visually in addition to just the numbers, but one of the ways we did it visually was through these spider diagrams. So again, here we have time and labor related to water again. And as you can see, the means are here. People thought that time and labor was measurable, comparable, useful for practitioners, on and on along the criteria. In contrast, this is what it would look like for privacy. People just didn't really think that we really needed to measure anything related to privacy in water collection. It's very different though for sanitation. Privacy was deemed very important, but not for water. So there's variability in the themes and by whether or not we're looking at water sanitation and hygiene. So we then had a very, a few other activities along this process. The themes were the main crux of the initial engagement. And once we agreed on those thematic areas, which we did through an externally facilitated meeting using all of these data, we then identified potential measures and potential indicators using that list of tools that I noted before and all those measures. We then shared these back with the core team, people commented, and then we all agreed on a long list of potential indicators with corresponding measures to go with them that people could use. This long list had 43 different potential indicators. We then shared that out to over 100 pre-identified WASH, gender, and measurement experts to review. We are very grateful for their time because many of them commented that it took over an hour. It was really, really useful to us though, because we were then able to analyze all those comments as well as quantitative rankings from them and refine the list even more. So we went from the 43 down to a list of 15, which is important because you can't measure everything, but it's also hard. So we posted then the 15 priority indicators on the JMP webpage so that people could review them. We had a series for water that included ability to meet basic needs, time and labor, safety and freedom from violence as the major themes. I'll let you all read that later, but also link to it. I'll have a link. For sanitation, ability to meet basic needs and safety and freedom from violence. Though I also want to note, but that ability to meet basic needs also includes cleanliness and privacy. And then also for hygiene along those thematic areas as well. What we did along with our public comment is commented on each of the indicators with more information so that people had more ability to really review. So each one had the indicator posted, whether or not there were existing measures that could be leveraged, and also provided a little bit more information about whether or not the measure was validated, if large-scale data collection had ever occurred, if it was ever reported on by the JMP report, for example. What we then did is we posted on the JMP webpage, kept it open for about 3 weeks, launching it at Stockholm Water Week, and had people be able to click on and comment on these 15. So anybody who had the link or anyone who made it aware, we also tried to go through Twitter or X or whatever you want to call it to get the information out. And so basically what this Survey Monkey looked like is it presented all of the indicators by water, sanitation, or hygiene theme. asked a general question about what people thought about that set. You know, is there anything missing? How do you, would you add something as a set? And then asked questions for each specific indicator, letting people comment about specifics that they wanted to add. So here we are now. We've finished that process. We've edited everything. We've got all the comments back, and we've collated, we've reviewed, and we have refined the indicators from those 15. I will say that the spirit of those 15 remains the same, but the comments were very useful because we have some refinement of some of our language, things that we clearly know we need to make sure we define clearly as well. We have a document drafted for guidance, and we're in the process of making final revisions and formatting that before it can be finally shared in December. But we still have some needs that remain. Specifically, not every indicator has a valid measure. Some do. Some do via DHS and mix. They have valid measures. They have large-scale data collection. Others need validation, and that work needs to happen. But we didn't want there to be no indicator put forward because there was no valid measure or data collected yet, because we just felt that these were important. And that's my cue to stop. There's more information here. If you, this scan. These scans actually are specifically for any of the links that I had. If you want to go to the top left, you can enter your email and we will gladly send you the guidance document once it is formatted and ready to go. Okay.
First, I just want to say I love your talks because it's a great speaker and I just want to get it. I was curious, so you have like in the very beginning of the trying to, I guess, you had stuff that you brought a group of experts together in the beginning. And I didn't miss this, but how did you choose? How do we understand everybody? Yeah, yes. I've always heard that method used by people. How do you choose experts? How do you make sure that you're engaged by these voices?
Yeah. Yeah, we had experts at a few different times, so I can clarify that too. So in the review portion, we had these consultations and it had a series of meetings. And so we had experts that we brought together there. We then had obviously the core group, which was smaller. We had the experts that we identified for the survey portion, and then we just had the public comment. So there are two time periods where we had bigger groups of experts. So this is a really good question. To be very transparent, you're not going to be able to include everyone as much as you try to leave things open for longer or send out the invitations or email follow-ups. People are busy and also the message just doesn't always get out. That said, we tapped all of the resources that we had available. I think we tried to access people in our own group and their networks and send things out. We were definitely working really closely with the JMP team. I'm going like this because Rick Johnson's standing right there, and that's who I'm referring to. And we would try to identify people through those different areas. But I think that that is actually an inherent problem, that we're not going to get everyone, and we didn't get everyone. And we tried to get as much. We actually specifically tried to record who was coming from what sector, what location, what their, what their gender is, all of these things, because it was important to us. And I will say with transparency that we could have done better, but I'm not sure how we could have made that better. Yeah. Christine.
Thank you for this. I'm curious, this is an opportunity to link to or catalyze measurement for other aspects of it.
I don't see this process as an end. I see this as a really important start to a conversation that we need to keep having. These might evolve by the post-SDG era because we've learned that something else needs to be added, or that some measure just doesn't really work and then maybe it's not as useful as we think. So to that end, though, I think that your point is really good because, okay, now we're doing gender, but what does that intersect with? And I think that it intersects with disability, among other things. There are other things that we can look at, and that actually can become more bespoke to different countries even too. How does that intersect with different regions? How does that intersect with different populations, indigenous populations in those areas? So I think this is hopefully a catalyst to springboard that and not sort of close the discussion on just gender alone. And definitely not just gender as a binary. Yeah.
So collaborating with JMP, I'm assuming kind of the initial target case was national level funding. I'm curious how much of this work you might see applying to, say, program evaluation or other applications.
Yeah, I think that's a really good question. I think one of the things that people could do with this in a program way is see if the data is also collected, for example, regionally or nationally, the programs can then use this data to see how what they're doing their population group might compare to the area, or how it measures up, or how that might instigate change over time in their sort of space to look at. So I think that indicators like this are certainly relevant to programs. I also think that very early in this stage, like this is a very nation stage, that any data is useful to see how well these work. You'd of course want to complement it with program specific, stuff, but I do think that these could be useful, provided that the programs were targeting some of the things that were here. But I think relevant. It's a good question, Lizzie.
I have two questions. First, was this specifically designed for Bloch and household settings? And then if yes, I can see that many of these indicators would be applicable in institutional settings as well, but to what degree were specifically used for institutional settings considered in development?
That's a really good question, and probably something I should have talked about earlier. So these were designed with individuals in mind, with the household thought of as probably the location of data collection. And sort of I say that because other data, the reason why it's not gender sensitive is because it's collected at the household for the household and doesn't enable that sort of intra-household. So you can go to the household, but individual, but yes, household areas. It's not institution in part because that was just also another review process and thing that is certainly needed, but was a little bit outside. It's a clear next step to think about, schools, to think about workplaces, to think about healthcare facilities, other public areas like transport, blah, blah, blah. So yeah, good question. Yeah.
Thanks.
Great. Thanks, everyone. We are at time, so I'm going to release the session. But I'm also going to volunteer my presenters to stick around for a few minutes because I know there are a bunch of questions in the audience we didn't get to. So thank you, everyone. Please join us for the poster reception, which is happening in the lobby from now until 6 o'clock.
Yeah, seriously.
Yeah,
Like,
we
that's like-
definitely coordinate around. Oh, okay. Hi. Oh, all right. I will see you there then. You're welcome.
Oh, okay.
I want elections in. Yeah, actually, it's like, well,
Mine is I'm not sure whenever you're working in
I like social that is quite nice.
Yeah, I mean, I like the part that we work with.
Okay, so small data, we talked to the.
I'm probably falling.
Like GPS data.
That's something that I don't, but this.
That doesn't necessarily align with population. Why do you need?
So you get this, you go down to. Yeah. This threshold. Since one for the also go on because
Okay, but does this specific area be official boundaries, or could it be like in proximity to whatever?
So that's where, you know, it's like. And so it's like.
I would also think it would be. That's very, you're bounded by these two streams or something like that. So there's one.
It's like. Well, it's.
What's the thing you did?
But like.
Yeah, and she's put it there.
Yeah.
It's really. Because you aren't.
All right. This all. But so I. So I just should be. But yeah, so.